Hi everybody, my name is Kristen Kelly and I'm a registered nurse. I have my master's in epidemiology, certified in infection control, and I am a mom of 3 boys. I'm here today on behalf of Medela to answer some of your COVID-19 questions, so let's get to a few of those. How do I protect myself? Pregnant women, lactating women should do the same thing as the general public when it comes to prevention. These tips are washing your hands frequently with soap and water or using the hand sanitizer, not touching your eyes, your nose, and your mouth with unwashed hands, catching a cough and sneezing into a tissue, discarding that tissue into the trash, and then washing your hands after, avoiding shaking hands, hugging, or kissing people at this time, especially during greeting, avoiding close contact with people who are obviously ill, and then social distancing, keeping enough distance to other people, which we know can be hard around the time that you've had a new baby, because this is a special time you want to be around others, but I think key to avoid seeing those extended family members so we don't spread the virus is important. Stay home if you feel unwell. If you have a fever, cough, or difficulty breathing, definitely seek medical attention. Next question, will it hurt my unborn baby if I get infected? According to the CDC at this time, there is not enough evidence to determine whether the virus is transmitted from mother to her baby during pregnancy or the potential impact that this may have on the baby. This is currently being investigated, and I know there'll probably be a lot of studies that will come out in the coming weeks and months. A small number of problems with pregnancy or delivery has been reported to babies born with mothers who have tested positive to COVID-19. However, it is not clear if these outcomes were actually related to the maternal infection or not. What is the status on delivery room restrictions in the United States? Hospitals vary on their policies for birth. The policies seem to be changing rapidly, so it's best to check with your own facility to inquire about what policies and any restrictions they have in place. For breastfeeding moms, question, do I need to stop breastfeeding if I'm diagnosed with COVID-19? UNICEF, the Academy of Breastfeeding Medicine, WHO, and the CDC report that the limited studies on breastfeeding women in COVID-19 and other coronavirus infections have not detected the virus in breast milk. It is not known whether the mothers with COVID-19 can transmit the virus via their breast milk. And currently, the primary concern is not whether the virus can be transmitted, but rather whether the mom can infect the baby through her symptoms, like runny nose, cough, her fever, her general virus shedding through respiratory droplets. So precautions to avoid spreading the virus to the infant include having the mother wash her hands before holding her baby and wearing a face mask, particularly when symptomatic, when in close contact with her baby. Can COVID-19 be transmitted through breast milk? It is not known whether mothers with COVID-19 can transmit the virus via their breast milk. For pumping moms, do I need to sanitize my parts more often? When using a breast pump to express breast milk, wash your hands before touching any pump parts and follow the CDC recommendations for proper pump kit cleaning, available at cdc.gov/breastfeeding after each use. If you have tested positive, recommendations include encouraging that someone who is not sick feed the expressed breast milk to the infant. General updates. Can I stop social distancing? Great question. I know that we are all excited for that moment when that does occur, but at this time, the health and government officials do recommend that we continue to social distance in order to stop the spread of the virus. It's recommended for us to avoid large gatherings and to maintain a distance of over 6 feet from other people. This reduces the chance of contact with those knowingly or unknowingly carrying the infection. What is the expected duration of the pandemic in the US? It all depends on when the infection rates peak, which is happening at different times in different states across the country. It might peak sooner than later in your state, but at this time no one knows the exact dates. Many models have been built to predict it, and we can continue to check with your local health department for the latest updates in your state. Medela is keeping an up-to-date website resource for all the information I've shared with you today, and will continue to bring information as it's obtained. See you all next week, and stay safe and healthy. Thanks.